The Center of Excellence in Reproductive Health Innovation, also known as CERHI, was established in 2016 by the World Bank in collaboration with the Nigerian government to build capacity in the West and Central Africa to reproductive health challenges.
Specific mission is to, first of all, the four principal objectives. One is to train masters and PhD students in nursing, reproductive health, health economics, and public health. And then also train PhD students in the same disciplines. And then do short courses, especially because we wanted to focus on professionals who are already in the field of reproductive health in policy making arena, but who probably are not using the modern paradigm in developing their programs and policies. And then the fourth was to establish a high-ranking laboratory that will be able to address some of the issues in terms of research and publications in the discipline. Our vision is to be the leading center providing information on reproductive health in the African continent, where we can be a consulting house. And today we're achieving that, where we'll be the reference point for anything that relates to reproduction and reproductive health within the West and Central African region.
Equipped with world-class facilities, the center empowers students with hands-on training and skills in its state-of-the-art laboratories, including an innovative high-fidelity simulation lab.
The university community has benefited immensely. For the first time, I saw simulation of delivery and all of that, and I tell you, it's an experience that I will live with because it was so real. When we talk about CERHI, we talk about the development of the university in terms of the Reproductive Health Initiative.
The high-fidelity simulation lab utilizes mannequins programmed to replicate real-life clinical scenarios.
This is the obstetric lab where you have a mannequin that can help demonstrate or teach or train learners on how to take delivery or conduct delivery.
These mannequins go beyond static models. They respond to student action and provide vital signs feedback, mimicking true patient encounters.
Baby's coming! Baby's coming!
The center has also benefited the students, not just the students enrolled in the program, but even the medical schools, basic medical sciences, they all use the facilities there. So I think it has empowered the university in terms of, availability of the facilities that otherwise we will not have been able to acquire as a university. It has also given our staff members opportunity to visit places and also be involved in research work. It has also created feasibility for us as a university.
Additional facilities within the center include lecture halls, a library, a teleconferencing hall, and a 4-star faculty guest house on campus. CERHI prioritizes innovations aimed at making impact in the lives of people. In 2021, the center launched Test for Life, an app connecting rural women to emergency transport during pregnancy complications.
Nigeria is a country that has faced the highest prevalence of maternal mortality rates, and women, especially in rural communities, resort to using their local birth attendants to carry out childbirth because probably they can't transport themselves to PHCs that are far away from them, and also cost of transportation to those places. The Text for Life app is an intervention that the Text for Life team has come up with to help solve these cases of transportation and also the cost of transporting themselves down to the PHCs.
By testing a code, registered taxi drivers are alerted to assist these women.
We're also using that same device to get women to report gender-based violence, which 1 in 3 women in this country, Nigeria, experience gender-based violence, and most of it are often unreported.
So far, we've helped 320 communities and in 10 states.
Today, the Test for Life app is used in 12 states across Nigeria.
We also work with partners in local communities here. The IDP camp, they are our collaborators, and as well as rural communities where we do a lot of basic research.
We have surrounding communities at the university, Ekosodin and other communities. We go out for outreaches, we do eye clinic, we check their BPs and all the basic medical treatments. So some of them do HIV tests, we offer both male and female condoms. We teach about family planning and all that. So since inception, community engagement activities we've done both individually and as a center is over 500 times.
In terms of pedagogy, the center applies a hybrid approach to ensure intensive but flexible studies, allowing students to balance education with careers. The center provides its international students with scholarship benefits such as monthly stipend, free accommodation, tuition, and research grants.
As a student for CERHI, we have benefits in terms of the finances. So one of them is tuition. We have tuition, and then there is accommodation, and then there is a stipend. And also we have internship, which is part of the program and is also funded by CERHI.
Our national students, they also benefit from our internships, paid internships.
I love research. I want to stay in public health research, although streamlined to reproductive health area. That's why I came here. And I have been given grants from the departments to go and on trainings within and outside Nigeria. I've been to Abuja for one training. I've been to the Gambia where I worked with the Medical Research Council. That was where I got first-hand experience of research work. I've been to different parts of the country on training. They've also given me opportunities to write research proposals for grants. I worked on 2 last year. I'm working on 1 this year.
I've benefited from this center in so many ways. So because of my interest in research, they've been sponsoring so many clinical research that I've been doing, including association of abruptio with hypertension among pregnant women. Then another one we're doing now on epidemiology of cervical cancer in this country. And another one was also sponsored on office biopsy for cervical cancer, a kind of a way to diagnose cervical cancer, which is deemed to be cheaper, especially adapted for low resource setting.
You don't need to think so much about money to come to school. There are scholarship opportunities available, and you just need to have the right information by walking into the office, the center's office, and then they tell you what to do from there.
For national students, right, our fees are subsidized compared to like international students.
We have a partnership relationship for research and capacity building. We have done projects together for the UNFPA. We have sent our staff here for training, and CERHI from time to time sends students to us for internship and sometimes just for experience. I would say we have sent about 5 of our staff here for training. And looking at the quality that they exhibited, I am also doing a course here.
In internships, we discovered that students learn a lot. And when they come back it transforms their behavior and their learning pathway, the way they normally learn.
The quality of training is top-notch, to be honest. You can access any lecturer at any point in time. They give you materials to help you study. They want to hear your thoughts and they advise you in line of your thoughts. They give you opportunities to grow.
We have access to like good facilities. Our learning environment is very conducive. Our lecturers are actually top-notch. We've been able to learn a lot from them.
The center has also been involved in helping us to publish other research papers.
You do not need to go so far to get quality education. It's just right at your doorstep.
I manage women, basically. Those that are pregnant as an obstetrician, I manage their pregnancy until they deliver. And also for those who have reproductive health issues, as a gynecologist, I treat pathologies and diseases that are related with them. The Center of Excellence in Reproductive Health Innovation, with the introduction of the program on reproductive health, we'll be able to have better understanding, especially in the area of the socio-economic challenges that are related with health issues. And on the basis of that, we've been able to bring the two together in trying to improve our knowledge, understanding, and application or approach to managing these women, especially where there are challenges.
CERHI thrives on global and local academic and sectoral partnerships.
We just established a collaboration with Imperial University in London, whereby we submitted a big grant proposal hoping that it will be approved.
Academic partners include the University of Ghana, the University of Malawi, Harvard University Medical School, the University of Ottawa, and King's University. While sector collaborations include the Federal Ministry of Health in Nigeria, the Ministry of Health in Ghana, United Nations Fund, the Bill and Melinda Gates Foundation, and many more. Additionally, CERHI partners with over 36 NGOs across Nigeria. Through the Reproductive, Maternal and Child Health AIDS Network, REMCHAN, the center collaborates with other centers of excellence in Ghana, Nigeria, and Senegal to facilitate internship opportunities for students at the national and regional levels. With over 264 articles published in peer-reviewed journals, CERHI continues to support change through the Africa Centers of Excellence for Development Impact Project, ACE Impact.